All right. Hello, everybody. Welcome back. Let's talk about clinicals and let's talk about what the expectation is and what the requirements are by the State Office of EMS. So let's take a look. Now, I'm going to show you the forms that I fill out that I send to the state for approval by the state. And this, I have to do all this before you test. This is the first form. This is called the Terminal Competency Form. And right here you see this is where all your grades go. And so I'll put that there. So everyone here has a CPR card, and I know it's current, so that your expiration date will go there. The TIMS class, so this is a transportation class. You need to check to make sure that you have TIMS. If you went to EMT school here at the county in the last few years, you know about it. You've already had it. If for some reason you're confused, I want you to reach out to Captain Pinson and ask him about that. Everyone should have ICS 100-700, and this is CAH. It's a hydroplasia class that's offered by the state. Again, if you went through our program, you should have this. If you, we're going to need copies of your certificates of completion. Now, if you completed it here, I'll reach out to Captain Pinson and he'll pull it up for us and we'll be able to, won't be a problem. But if you did not complete any of this, which TIMS and the hydroplasia class is the only ones that I might be concerned about, feel pretty confident everybody has 100-700, then but we're going to need to make sure that we have copies of those certificates. All right. Let's look at the next one. This is called the AEMT file review. So let's talk about this form. Here it says 48 hours. That's your minimum requirement to ride on an ambulance. Okay. Now, let's go down here. Let's look at what it says. Capstone. After you've completed 48 hours on the ambulance and have obtained all the skills required for AEMT in the clinical setting, you may then ride for 24 additional hours as the AEMT in a lead position. And speaking of that, if we go over here, let me scroll down a little bit. We'll say that right here, and I wish I had a pen or something that I could circle this with, but you see my cursor. Follow my cursor. Go down, 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 down where it says internship team leads. This is where you'll do those team leads inside that 24 hours of capstone. Okay, so let's look at your patient assessment by age. You must have a total of 30 patient assessments. So that's 30 patient care reports that I have to have. Out of those 30, 5 of them must be pediatric patients. See where my cursor is. 5 pediatric patients. You have to have 10 adult patients. Now look at the peds. Let me back up. That's 0 to 18 years of age. Now let's look at adult, 19 to 64. You got to have 10 of those. And then 5 geriatrics, 65 years of age or older. That doesn't add up to 30, but you have to have 30 patient assessments and at least 20 of those have to meet those requirements. We're going to look at patient assessment by pathology, right? So if we go down, we see that you have to have 4 that meet a cardiac patho complaint. This is cardiac related chest pain or chest discomfort. 4 of those need to be medical neuro. These are altered mental status patients, stroke patients, brain bleeds, any of those. 2 of those can meet other medical complaints, and that's a wide variety, right? Leg pain that's non-traumatic, abdominal pain, nausea, vomiting, things like that. 2 psychiatric behavior complaints. 4 respiratory patho complaints, right? So these are going to be your patients with asthma, COPD, pneumonia, things like that, because congestive heart failure would fall under your cardiac patho complaint. And 4 traumas. Let's look at the success rate of skills, right? So IV access, it doesn't matter, right? But I'll show you in a second where you have to at least make those attempts. We go down. You have to have one medication administration. That should be pretty easy. Albuterol, Atrovent, Narcan, things like that. It has to be a drug. Normal saline doesn't count. Lactated ringers, none of your IV fluids count as a medication administration. It has to be a legitimate med. Now, you need to have 10 IV accesses, right? So at least 10 of those need to be documented. 20 Gemesis Elite patient care reports. So those are going to be completed on Gemesis Elite. You have to have 20 of those. And then down here, I've already explained the internship leads. We've completed all of these scenarios in class right here. So those are simulated only, and we've completed those. Let's look at the AEMT required labs. So if you look right here, required lab skills, we've completed all of these in class. So we're good there. Additional requirements. So after you've done, let me back up. After you've done your total of 48 hours on the ambulance, after you've completed that, if for some reason we haven't done these, we will have to do these as simulations. Cardiac arrest, distressed neonate. So I imagine we'll be doing that in the lab. OB, possibly doing that in the lab. Defibrillation. There's two of those. You need to bag somebody for a total of 4 times. You need to do CPR twice. Endotracheal suctioning, 2 of those. Administer IM injections. We're going to do 4 of those. Intranasal, 4. IO, 4. Administering IV bolus medications. So those would be 4. So Narcan would be 1, D50 would be 1, D10 would be 1 of those. So we would need 4 of those. Any type of other meds, whether it's PO, sublingual, right? We need 4 of those. IV access, we're going to need 4 of those if you haven't met those requirements. Establish IO access, 4. Supraglottic airways, 4. Venous blood sampling. So we'll do those in the lab. I have the tubes and all the stuff for it, 4. And end-tidal CO2 monitoring, 4. So you need to make sure that you're documenting. If you're using end-tidal CO2, you need to make sure that you're documenting that in your patient care report in order for me to be able to count that. We'll be looking for all of these in your patient care reports. And all of these, we showed evidence of competency. We talked about that on the first day of class. All right. So if you have any questions, please reach out to me. Feel free to reach out to Captain Pinson. If it's a schedule related, the schedule, I'll go ahead and attach the third ride schedule to this video so that everybody has that online. It has access to your schedule if you lose the copy I give you in class. Or if you're like Gathers and you don't say hello to me after you take the exam, he needs it. So you'll also have access to all of that. Okay, enjoyed talking to you, and I look forward to seeing you soon. Please, please, please stay on top of these clinical assignments. Make this happen so that we can get you guys done and tested and get that beautiful AEMT license that you all worked so hard for. Thank you.